Good morning, everyone. I'm Cliff Yaffe, and I'm the Associate Dean of Postgraduate Medical Education in the Max Rady College of Medicine, and I'm honored to be reading this citation today. The highest honor the Senate of a university can confirm upon an individual is an honorary degree. At the University of Manitoba, the criteria includes distinguished achievement in scholarship, the arts, or public service. Our honorary graduate this morning is Dr. Martin Joel Yaffe, my brother. For many researchers, the joy is in the moment of discovery. For Martin, there is a much greater source. Joy is when you see how ideas come to life to make a real difference in the world, far beyond the lab. Dr. Yaffe is best known as a pioneer in digital mammography. It was a huge advance over the film mammography in use before the new millennium. Digital technology means more accurate detection of breast cancer. It also makes diagnostic information much easier to enhance and share. Digital mammograms now help patients and their doctors make more informed decisions when it matters most. Dr. Yaffe was one of the first scientists to see the full potential of this technology for breast cancer screening. He did much more than develop this innovation in the lab. He made sure his findings became meaningful advances for care. The transformation of a brilliant idea into everyday clinical practice in its great passion is often the greatest challenge. It means carrying out large-scale trials to prove the potential benefits and capturing the imagination of industry leaders who are key in bringing great ideas to commercial fruition. Because Dr. Yaffe was willing to go the extra mile, working in collaboration with professionals from many different disciplines, digital mammography is widely used. It has revolutionized the way breast cancer is detected. The technology saves thousands of lives every year and is now a modern standard of care across the globe. When asked what motivates him to bring research into real life, he simply says, "Well, I'm a practical guy." That practical nature was instilled in him as a kid growing up in the North End of Winnipeg. He is the eldest of 3 sons and the grandson of immigrants from Russia and Belarus. Our family was of modest financial means, but rich in appreciation of learning. Our parents encouraged us to study hard and do good things with our lives, and each one of us tried to rise to the challenge. As a child, he had many interests, from engineering to electronics. He chose science as a career, encouraged by the success of our uncle, who was a nuclear chemist. One day, while studying here at the University of Manitoba, his class heard from a visiting researcher who spoke with great passion about the contributions physicists could make to medicine. So moved was young Martin that he decided to make medical physics the focus of his graduate studies. Years later, that same scientist heard Dr. Yaffe speak. Now it was his turn to be impressed. He offered him a position in his lab at the University of Toronto, where Dr. Yaffe earned his Ph.D. His mentor instilled in him the firm belief that a scientist must strive to make positive changes in the world. For the next 40 years, Dr. Yaffe would remain committed to moving his discoveries into usable resources. He continues to pioneer new tools for managing and understanding breast cancer, and he continues to find the joy born from contributing to the larger efforts to help save the lives of women and men facing this difficult diagnosis. Mr. Chancellor, it is an honor for me to ask, on behalf of the Senate of the University of Manitoba, that you confer on Dr. Martin Joel Yaffe the degree of Doctor of Science honoris causa.
By virtue of the authority vested in me as Chancellor of this university, I admit you to the degree a Doctor of Science, honoris causa, with all the rights and privileges thereto appertaining. Congratulations, Dr. Yaffe.
Good morning, everybody, and thanks, Cliff, for the beautiful remarks. Really do appreciate your comments. President Barnard, Chancellor Sector, Dean Postal, honored guests and graduates, I'm humbled and honored by being chosen to receive this recognition, and I thank the university. I wish that our parents, and especially our mother, could have been here to see this, because their values had a lot to do with Cliff and me being here today. I left the University of Manitoba in 1973, as Cliff mentioned, to join the lab of Dr. Harold Johns in Toronto, where I did my Ph.D. But for those of you who don't know, Dr. Johns was responsible for bringing cobalt radiation therapy and radiation therapy in general to Canada and making Canada a world leader in this area. Also, by the way, at that time, the name of the Prime Minister of Canada was Trudeau, and a major topic of conversation in the press was cannabis. Some things just don't seem to change. But today I won't be talking about Mr. Trudeau or about cannabis, but we'd like to share just a couple of thoughts. I know you're anxious to receive your degrees, about science and evidence in medicine. And Dean Postal has mentioned some of these ideas already. Although I've never considered a career as a physician myself, I've always had a great respect and awe for doctors, something that persists to this day. To have the skills to diagnose, to treat and cure the plethora of health problems that plague us is just amazing. And what a responsibility and what a privilege you have. Medicine is an art requiring technical acumen, but it's also firmly based on science. And the developments in science and the technology that have come from that science have simply been revolutionary. As part of my education in imaging research here at the University of Manitoba, I watched Dr. Neymark, I watched Dr. Ian Sutherland doing pioneering work in nuclear medicine, and Dr. Ted Lyons experimenting which was then the new technique of ultrasound. We had just heard about the invention of the CT scanner, and what incredible developments have occurred since then. They have revolutionized medicine. Just consider MRI, PET, computers in every aspect of medicine. Everything is digital today, and the computers at the time I was here ran on punch cards or long spools of paper tape and were truly primitive by today's standards. We have targeted drugs for precision therapy of cancer and other diseases, 3D printing of implants, modern laparoscopic and robotic surgery, artificial intelligence, and hopefully we still have some real intelligence. These innovations came from the work of scientists and clinician researchers in medicine and have been truly transformational. These are the tools that you will get to use in your work. They came from scientific research. My message to you as you begin your medical careers is that it's critically important that you stay engaged in science. The obvious way to do this, if you're so inclined and so talented, is to integrate research as part of your professional careers. Become a clinician scientist. Medical research is exciting, rewarding, and fun. The work connects you to colleagues around the world and builds the future of your profession. Subspecialties that don't innovate and evolve through research will eventually become extinct. But even if research is not for you, it's vital that you take a scientific approach to your work. And here's why. Today, in discussions with my colleagues who are physicians and sometimes as a patient myself, I've observed a shift toward doctors, at least some doctors, seeing themselves more as technical people and being pushed into the role of financial gatekeeper, obediently following guidelines by funders and various advisory groups. Procedures are often ordered or not ordered on the basis of these guidelines. Now, guidelines can be very useful. Doctors are busy people and can't possibly know all the research literature. So this is evidence-based medicine, where scientific evaluation of efficacy and effectiveness of interventions should inform or regulate their use. This is a great idea. We need to test drugs and procedures to determine if they work or not. And in a world with limited resources, we need to consider their cost utility. How much does it cost to save a year of life or to reduce morbidity? In Canada, provincial and federal health systems have come to rely on advisory groups to evaluate the science and recommend evidence-based policy. This sounds like a great idea, but unfortunately, these days, with the financial pressures on governments, the message has come out often that less is more. Consider, for example, the Choose Wisely Canada effort, or the Canadian Task Force on Preventive Health Care. While they and groups like them are supposed to employ the analytical tools of science, more and more it seems that their mandate is less evidence-based policy and more of what I call policy-based evidence, looking only at the data that supports a particular position, for example, reducing costs. We have to beware of this false science. Unfortunately, I've seen a clear example of this in how the task force has handled the issue of mammography screening. The task force has completely ignored key Canadian data that's come right here from this country, and shaded their analysis to overemphasize harms and understate benefits. And many doctors have been led to believe that screening doesn't work. That's simply not true. Screening can be very effective. And the task force responded similarly regarding PSA and prostate cancer. This is a serious concern and doesn't serve the health interest of the public. Another example, in Ontario, where I work, the Ministry of Health withheld the drug Herceptin from women with 9mm HER2-positive breast tumors, whereas women with 10mm tumors, not much difference, were provided with this very effective drug. So there's no valid scientific reason for this kind of a decision. And I'm sure that there are many other examples. Often guidelines committees are populated by methodologists in epidemiology who understand the diseases on which they're opining far less well than you do. Therefore, it's essential that physicians understand the scientific basis of the reasoning behind these guidelines and are equipped to decide for themselves if guidelines make sense. You need to be able to question and, if necessary, challenge guidelines built around policy-based evidence and really develop evidence-based policy. So my message for you is very simple. If you are a physician who thinks scientifically and understands the science underlying your art and your practice, you will be a better doctor, a more empowered doctor, and I think a happier doctor with healthier patients. Thank you so much. I wish you all the best of success and fulfillment in your chosen work.